Good morning, students. Last class we have discussed about the anatomy of breast, including its blood supply, venous drainage and nerve supply. And I have told you that in next class we will discuss about the lymphatic drainage of breast, which is more important because the lymph nodes are involved in cancer breast. And during clinical examination of breast, the lymph nodes have to be examined. Yeah. Now let's see the lymphatic drainage of breast. So the breast drains into axillary lymph nodes. So these are the axillary lymph nodes, and the axillary lymph nodes are 20 to 30 in number, and they are situated in the axilla. They are classified into groups. So we have groups: anterior group, otherwise called pectoral group; posterior group, otherwise called subscapular group. Then we have a lateral group and central group, apical group. So these are the 5 groups of lymph nodes. So in this, anterior group is otherwise called pectoral group, posterior group is otherwise called subscapular group, apical group is otherwise called infraclavicular group. So these are the groups of axillary lymph nodes. Now let's see what are they. So this one is the pectoralis minor muscle, and this one is the teres major muscle. So this is pectoralis minor. Along the lower border of pectoralis minor, this blood vessel is the lateral thoracic vein. And this blood vessel is the subscapular vein. And till the teres major, this one is basilic vein. After that, it is named as axillary vein. All these things we have learned during the venous drainage of breast. And this part is subclavian vein. Yes. So along the lateral thoracic vein, these lymph nodes are situated, and they are anterior group of lymph nodes or pectoral group of lymph nodes. They drain the upper half of the trunk anteriorly and also the breast. The importance of this group of lymph node is they are very close to axillary tail of Spence. So any enlargement of axillary tail of Spence can be misdiagnosed as involvement of the anterior group of lymph node in cancer breast. So that is the importance about the anterior group. Coming to this group of lymph nodes, which are situated along the posterior axillary fold along the subscapular vein. So these group of lymph nodes are posterior group, otherwise called subscapular group. And this group of lymph nodes drain the upper half of the trunk posteriorly and also the axillary tail of Spence. And this lymph node, group of lymph node, which is situated along the axillary vein in the upper part of the humerus, this group is called as lateral group. And this lateral group of lymph nodes drain the limb from the upper limb. Okay. This group of lymph nodes, which are situated in the axilla, axillary pad of fat, they are central group of lymph nodes. The central group of lymph nodes drain the limb from the upper limb and also from the major part of the breast via the other lymph nodes. And this central group drains into the apical group of lymph nodes. So these are the apical group of lymph node, otherwise called as infraclavicular group. So this apical group of lymph node is situated in the axilla deep to the clavipectoral fascia. And this apical group of lymph node is more important because they receive lymph directly from the upper part of breast, which will be situated here, directly from the upper part of breast, and indirectly from the breast via anterior, posterior, lateral, and the central group of lymph nodes. So this apical group of lymph node drains into on the right side. It drains into subclavian trunk, on the left side it drains into thoracic duct. And some efferents from the apical group also goes to the supraclavicular group of lymph node. So the lymph nodes examination must be done in clinical examination of breast because they are involved in cancer breast. These are the group of lymph nodes. We can also classify them into levels. In clinical examination they will classify into levels. So level 1, level 2 and level 3. How are they classified? So level 1 group of lymph nodes will be situated lateral to the lower margin of the pectoralis minor muscle. So this will be the level 1 group of lymph nodes. Level 2 lymph nodes will be situated deep to the pectoralis minor muscle, and level 3 lymph nodes will be medial to the upper border of pectoralis minor muscle. So if you put the direction, so this one is lateral, this is medial, and this is superior, and this one is inferior. So level 1 group of lymph nodes lateral to the lower border of pectoralis minor, level 2 deep to pectoralis minor, level 3 medial to the upper border of pectoralis minor lymph node. And we must know a term, that is sentinel nodes. So what are sentinel nodes? These are the lymph nodes. They are the first lymph nodes to receive lymph from a particular part. So sentinel node examination is very, very important if you suspect cancer. So how can you examine the sentinel nodes? How can you know the sentinel node is? Inject a radioactive substance in the particular area and we can find the radioactivity in the lymph nodes, sentinel lymph nodes. And the axillary lymph nodes can also get infected and they can form an abscess. In abscess formation, if they drain, if the pus is pointing along the axillary sheath, then the pus will be pointing along the limb, or it can point to the neck also. If it breaks the clavipectoral fascia, the pus will be between pectoralis minor muscle and pectoralis major muscle. How to drain the axillary abscess? We have to put an incision along the floor of the axilla, between the anterior axillary fold and posterior axillary fold, along the medial wall of the axilla. Why? Because along the anterior wall, along the posterior wall, along the lateral wall, we have blood vessels. To avoid injury to all the blood vessels, we have to put an incision on the medial wall of axilla. So this is about the axillary lymph node. Again, I am just giving a gist. Axillary lymph nodes, we are having groups, 5 groups. Anterior or pectoral group situated along the lateral thoracic vein, posterior or subscapular group along the subscapular vein, lateral group along the axillary vein in the upper part of humerus, central group along the axillary vein, apical group along the axillary vein. Yes, and then we have levels also. Level 1 lateral to the lower border of pectoralis minor, level 2 deep to pectoralis minor, level 3 medial to the upper border of pectoralis minor muscle. Please revise the topic. and come prepared for the next class, which is going to be your brachial plexus. Thank you.